What are your top recommendations for not only men, but women and children living in our industrialized society?
Well, you know, the Archives of Internal Medicine published in 2002, volume 162, a report, which is the NANES 3 study, that nearly 70% of all cancer deaths are related to the presence of chronic low, and the key word here is low, levels of lead. Also, nearly 50% of all cardiovascular deaths were due to chronic low levels of lead. That means these substances in the 21st century are injuring our cells, and we have no efficient way to reduce it. We are all exposed. Every single patient I've studied on a random sample of their blood has not one, not two, but at least 3 or 4, and some of these significantly elevated levels, but not at thresholds we were taught in medical school as toxic. So by delivering EDTA, which I consider a 21st century antioxidant for the 21st century, it grabs these cell-damaging metals such as lead, plus a broad spectrum of others, and I saw nice reductions with mercury as well. And by doing this, we are relieving the body of another cell-injuring link to our 2 biggest killers. And in addition to that, of course, we present to them the entire portfolio of lifestyle hydration, controlling your carbohydrates so you don't stimulate insulin outpouring, which stimulates growth throughout the body, no matter what tissue. Insulin will stimulate the growth, and in our high-carb society, of course, we're seeing tremendous amounts.
So, Dr. Ellithorpe, when you see women who are wanting hormonal replacement, do you go and approach them that they need to adjust their carbohydrate intake, or
yes?
To what point? Because I would imagine that there could be a failure of proper estrogen replacement if their carbohydrate intake remains too high.
Absolutely. I try and explain to my patients that their blood vessels are a highway system, and if they eat an unaccountable volume of carbohydrates, there's a blizzard of glucose absorption into their blood multiple times a day that inhibits cell-to-cell hormonal communication, and very often, by just adjusting their diet, they have less hot flashes and so forth.
And Dr. Ellithorpe, I understand that you're going to be writing a book soon. Can you tell us about that so we can look forward to it?
It's a summary of many of these basic statements about the fact that we are in the 21st century, learning to live with, for instance, if 5,000 airplanes fly over the United States every day, and if they have tens of thousands of pounds of petrochemical fuels that use heavy metals as a template for efficient, smooth combustion, the exhaust is dumping over the United States powder and powder every day of these heavy metals. So even if you're trying to eat organically, it's going to grow up into your broccoli and spinach and so forth. So we have to look at ways to address this cell-damaging toxic element linked to our 2 biggest killers. And so the book will emphasize these things and examples of patients. I've had patients who, with this therapy, have had optic neuritis, legally blind, couldn't drive, had to walk with her hand on their husband's arm to make it into my office, have seen neuro-ophthalmologists, been on steroids again and again, and now, within about a year's treatment, are driving again.
I mean, this remarkable.
Is amazing, yes.
Yeah, it's really great. You know, I want people to know how to get more information, and your website is tlcmd.net.
Yes.
And there's another website about the suppositories themselves, which is www.detoxamin, detoxamin.com.
That's correct.
You know, Rita, it's been a joy to talk with you because I know how much we could talk all day because of the breadth of your knowledge and information beyond prostate. But I think the underlying issues that you're addressing for everyone's health is detoxification.
Yes. I really appreciate your having this opportunity and your work in getting this information out to the public. It's a blessing.